Okay. We are from the ETSU Dental Hygiene Clinic, and we just come today to talk a little bit about caring for an older patient. This is Lindsay, I'm Becky, and this is Amy. And I'm going to start out, and then Lindsay's going to go, and then Amy's going to go, and then I'll talk to you again a little bit. I'm going to start out first.
North Hall Nurse, you have Column Park 1, North Hall Nurse,
the
Park
difference
1.
between someone that's got a healthy mouth and someone that you're going to start to see problems in. Healthy, with here, you notice that it's very pink, and it's going to be that pale pink or more of a coral pink color. That's going to indicate you've got more healthy tissue. As you get toward where the lips form, you're going to see more red because it's a little more vascular there. But right here, you're going to see the pink. This is someone that actually has gingivitis. You can see how red it is, and actually the tissue in between the teeth is swollen and inflamed. So those are signs. Also, you're going to see bleeding when they brush or you brush their teeth, and also the same thing with flossing. Any signs of bleeding in the mouth is not normal because you shouldn't see anything there. What causes that is just simply plaque on your teeth. It's just bacteria, and so it's your body just coming to fight off that infection. So that's what you're going to see. And in patients, even patients that are edentulous, they don't have...
Sorry, I had to go all the way to the lobby.
Okay. They have, even patients that are edentulous, they don't have their teeth, they wear dentures, their tissue shouldn't look like this. It should still look this pink color, more toward a white color than it's going to be this red. This can actually be really uncomfortable with someone wearing dentures because it's fitting on top of that. So it's going to be really sore. It's going to be really hard for them to keep their dentures in. And Lindsay's actually going to talk to you a little bit more about dentures and how to care for them and some of the conditions with dentures.
Knowing how to take care of the soft tissue and the gums of the mouth is also just as important as knowing how to take care of the actual denture itself, of course. Many people are taught to just brush the denture with a regular toothbrush and toothpaste. I don't know if that, can you, hold on, I'll do, okay. And so you want to, if you brush the denture incorrectly with the toothbrush, it can actually scratch the denture because the denture material is just easily scratched and damaged. So we recommend that you use a denture brush, two dentures, because they're shaped for the denture. And there's a picture of the denture brush on your pamphlet on the back. It's got that curved brush. So we recommend that you use that, and also if you don't have a denture brush, you want to use just a soft bristle brush, not medium or hard, because that'll scratch up the denture too. And each patient needs their own individual toothbrush and as well as a denture brush too. They can be brushed with a denture paste or with a mild hand soap. You don't want to use anything that's too abrasive or toxic, like the toxic household chemicals or anything. And they need to take them out for 6 to 8 hours a day. To soak them, you want to soak them in water or a denture cleaning solution. And it's really important to do that to keep the denture from drying out. But you also want to do that because if they don't take the denture out for 6 to 8 hours a day, if they leave it in for too long, you can get this denture-induced stomatitis, and that's just inflammation of the blood vessels and everything where it can't get enough oxygen to the tissues because the denture sits on there all day. And so you want to make sure that they're taking that out, and once it is taken out, you want to brush the soft tissue and the gums with a soft bristle toothbrush. Or you could also just use like a sponge, just make sure that you're massaging the oxygen back into that tissue because you can see here it's inflamed and red and painful, so don't want that. And so that's about it for the denture care, but you want to talk to them about toothbrushing?
Yeah.
Well, you want me to go ahead and talk to them?
Oh yeah, you can go ahead.
Okay.
It's whatever you want to do.
Okay, well, I'll go ahead and talk to you a little bit about xerostomia or dry mouth. And it's caused by changes in the quality and quantity of saliva. And clinical signs include a swollen, dry, red tongue, a burning sensation, difficulty with speech and swallowing, and change in taste. And it's oftentimes a painful and uncomfortable condition for, the patient that you're caring for. In xerostomia, dry mouth, it's a common symptom among older people. It affects 29 to 57% of older people. Saliva flow does not decrease with age alone. There are many possible reasons that someone may suffer from dry mouth. It's common among patients who take medications, have certain connective tissue and immunological disorders, or have been treated with radiation therapy. The most frequently reported cause is the use of medications. Many commonly prescribed medications have been found to produce dry mouth as a side effect. Many conditions that control high blood pressure can have it as a side effect, and those include like ACE inhibitors, beta blockers, calcium channel blockers, and diuretics, and other medications like analgesics or like NSAIDs, like ibuprofen, anticholinergics, antidepressants, antipsychotics, muscle relaxants, and sedatives can have it as a side effect. And also, dry mouth can accompany conditions like rheumatoid arthritis or diabetes. And it can also be caused from like anxiety, anguish, stress, alcohol abuse, and heavy smoking. So as you can tell, there's like a lot of reasons why someone may have dry mouth. It's often considered to be an underestimated or ignored problem. It's hard to diagnose because it's not measurable. One may not realize how important saliva is with regards to eating and drinking and with anything. And saliva has an important role in maintaining a healthy mouth and tissues. It lubricates the mouth, helps prevent tooth decay or cavities, and also protects against fungal and bacterial infections. It has profound effects upon one's quality of life and influences functions, like I said earlier, such as sleeping, speaking, eating, and swallowing. And when the ability to eat is affected, malnutrition can result. And also it can contribute to lower self-esteem and reduce the enjoyment of eating. It can be difficult to implement and maintain good oral hygiene among patients with xerostomia. Things such as periodontal disease or gum disease, cavities, or bad breath can occur. And bad breath can affect one's social life, so that's something else. You want to encourage them, to get out around people, and dry mouth can affect things like that. It's nearly impossible for patients suffering with dry mouth to wear dentures because the saliva kind of helps suction the denture into the mouth and holds it in place. So not being able to wear a denture or have to constantly worrying about it falling out can affect one's life. Dry mouth needs to be taken seriously and managed appropriate to enhance a patient's well-being. Terminating certain medications may not help xerostomia if it's due to a systemic disease. So it's important to find the underlying cause in order to help the patient with this problem. And there are many treatment options that can be used to help with it. Over-the-counter saliva substitutes, such as biotin, can offer some relief, and sugar-free candy or sugar-free gum is good. It can help you build up saliva. Encourage the patient to drink water, avoid alcohol, and decrease the intake of food and drinks that have caffeine or sugar. Use of fluoride mouth rinses is something else. It's important to help fight against cavities that may result from dry mouth. So that's just some things you can remember maybe if you come across someone who, is complaining or has it. So.
Okay, let me swap places with you and see. What we're going to do is show you 2 different ways you can actually brush a patient's teeth. So like if they actually have their natural teeth, you can do this. This is the most preferred way. We call it the 45-degree angle. Most people take their bristles of their toothbrush and put them straight on their teeth and then just brush back and forth, kind of like a sawing motion. And what you really want to do is you want to angle your brush so that this top edge of the bristles is right on the gum line. And all you want to do is wiggle gently and just sweep it down. And you actually are going to do that all the way around. You're just going to wiggle and sweep down and wiggle and sweep down. When you get to the front, you're going to kind of just flick like this so that you can get the backs of the front teeth like that. And you do the same thing on the inside of the mouth too. You're going to make sure that you've got that brush up against the gum line, just wiggle and sweep it down. And that's really the best way to go about removing plaque from a patient's teeth and getting it away from that gum where it's really going to be irritated. Another way that would be really good, especially if your patient can't hold their mouth open for long, if you can get them to open to put the toothbrush in, you could do small circles as well. Just on each arch individually, because the small circles will do almost the same thing that 45-degree will. It's not as good, but this way they don't have to try to keep their mouth open, or you're not trying to have to hold their mouth open for them. So either try the 45-degree or the small circles when you're brushing their teeth. Some patients may actually be able to brush their own teeth, but they can't grasp the toothbrush. It's too narrow for them. Arthritis especially will affect that. So what you can do is you can actually just take regular kitchen sponges, and what you can do is you can actually just rubber band them to your toothbrush handle, and it creates a much broader base for them to grab, and then they're able to brush their own teeth. You can do the same thing like a stress ball, or just the little tiny foam balls that you can get at like a dollar store. You can cut a hole and slide it on, and they can grab that as well. Just to hold on, but it does create that wider base for them to grab and do it themselves. Also, limited range of motion. So like if they can't take their arm and move it up and do this, what you can actually do is you can take like a ruler or any piece of wood really that's kind of got a flat surface to it, and you can actually attach the toothbrush to it with rubber bands, and once again you can still put those sponges on that ruler itself. They have a longer handle to hold it with, and they don't have to try to put their hand right up to their mouth. So it does, once again, allow them to brush their own teeth that way. They do have, can you get me the picture out of my bag? Right there. They have these brushes available. The brushes themselves, I think, are like $7.50 or something, but these are called suction brushes. And this is actually kind of horseshoe shaped, and it's got an opening in the middle of the brush, and the handle is hollow. And so what you do is when you're brushing, you just brush the patient's teeth and put your finger over it, and it'll suck all of the toothpaste, all the saliva, or if they had mucus and food particles, it would actually suck that out. And you can use it with a standard suction line. They do sell portable vacuum units that you can use, and it has a suction container with it. But this is for, we recommend these for people that are like in hospice care, or patients that have trouble swallowing and spitting, things like that. That's really good for them to use too. Once again, it's the same thing. Everybody needs their own toothbrush. You don't want to take it from one patient to another. And it's important it has a place that it can dry. You don't want to leave it sitting on the sink where the bristles are touching different things, because it's just going to allow bacteria to collect in it. And the same thing with the suction. You just kind of want to make sure you clean that out in between, because if not, it's just going to collect inside the toothbrush handle, and then you're going to have bacteria growth in there as well. Okay. And I think that's all we have. Did y'all have any questions for us that you wanted to ask?
Thank you for coming.
Oh, thank you so much for letting us come.
You explained yourself very well.
Oh, thank you. Thank you.